Hello and welcome to UK Fitness Hub. Thank you for clicking onto the sports massage page of my website. What I thought I would do is put together some of the most frequently asked questions that I get in sports massage therapy, whether that's via email or alternatively in a consultation, and provide you the answers to the most commonly asked questions that I get. So let's get into the video. So the most commonly asked question that I get without fail is, where do you work? So I work at Eden Sports Clinic. I work every Saturday here and I start my shift at 9 in the morning and finish at 5 in the evening. If you are travelling to Eden Bridge to see me at Eden Sports Clinic, we're located on the High Street. There's ample parking at Waitrose, which is around about 30 seconds away in terms of a walk. And also there's a community car park that's even closer, both of which don't have any timed restrictions in terms of parking. If you was to come via train, it's around about 5 minutes of a walk to the high street from the train station that's closest. And if you was to travel via bus, the bus does take you into the high street as well. So there's plenty of transport links in terms of coming to see me. Now moving on to pricing. So how much does it cost to see me at Eden Sports Clinic as a sports massage therapist? So it costs £60 for an initial consultation. The difference between an initial consultation and a follow-up appointment is, in an initial consultation, it's really important that I take the time to sit down, have a chat with a client. One, to find out, am I the right person to solve the issue they've come in with? And also as well, what are they looking for? What are their needs and wants? Sometimes I have to refer people on because maybe I'm not the right person for them. And the initial consultation process allows me to be able to ask all the necessary healthcare questions that I need to ask. For follow-up appointments, it's £60 for 60 minutes and £45 for 45 minutes. We've got a great studio private gym here, and what I'll generally do is, with aftercare, rather than me awkwardly do it in a small little massage room, we use and go out into the gym as therapists to be able to show clients what stretches, what aftercare, what exercises they need to do. And it's the right type of environment to be able to get them alongside with me. I'll show them how to do it. I'll get them really confident and comfortable. And then that also plays a part in your treatment time as well. So you get your consultation, your massage, and aftercare, if applicable, during that initial consultation process. Will sports massage help with general aches and pains? So this is really why I do my job, to help with general aches and pains, to help people recover from injury, potentially people that have high stress, medical conditions, anxiety. So absolutely, if you've got general aches and pains, do come in, and that is something I'm sure I can help with. Another one of the most commonly asked questions I get, and specifically from people that aren't perhaps interested in sport or physical activity, is a sports massage therapist right for me? And the answer to that question is, if I think about my client base, 50% of which are interested in sport, they're interested in fitness and physical activity. They might come in with injuries or problems, or look to have body maintenance and get themselves in the best optimal shape of their body to be able to then participate in events or whatever they do in terms of their recreation or sport. However, 50% of my client base do not fall into that category at all. So I have a lot of chronic pain clients that have no interest in sport. I deal with a lot of injuries that certainly weren't done via sporting injury or at the gym or anything like that. I deal with stress, chronic tension, anxiety. I have patients with fibromyalgia and lymphedema. So I think as a massage therapist, how I would alter what I do depends on who's sitting in front of me. And certainly I have a very diverse and wide range of clientele that fit into all different types of categories. And as a therapist myself, I'll then mold into who I need to be and what I need to treat like for the person in front of me and their condition. The next question is, does sports massage hurt? The classic question, is it going to be really painful? What am I letting myself in for? I think the most important thing to remember is, as a therapist, I see so many different people that want so many different things out of sports massage therapy. So the most important thing is I'm altering my techniques and myself for the person sat in front of me. So if someone's come in and said, Travis, I'm dealing with high levels of stress and I really want something relaxing, am I then going to start putting elbows into their back and causing them significant discomfort? Absolutely not. Some areas can be tight and sore, or what we call hypertonic, and therefore you might have moments during a massage where it's a little bit uncomfortable. However, if anything was too much, I'm essentially here for the client. So if anything they felt was a bit too high in terms of pain level, the most important thing is they communicate with me. But no, not purposely. I don't ever try and make sports massages, to the point where somebody is clenching themselves or not breathing. And the most important thing really is we're getting a beneficial response out of the body. And sometimes that can be done without having to pummel the body and really make it sore after treatment. But again, it all depends on somebody's goals, what they're looking for. And this is where that effective communication in an initial consultation comes in, so I can get to know the client, get to know what they want, and adapt myself from there. The next topic I'm going to cover is pregnancy massage. So I get two questions very commonly asked, which are, one, do you massage pregnant women? Can I still get a massage if I'm pregnant? And question two then follows on, how is the modifications made for me when I'm coming in for a massage? So what's different from if I come in with a regular massage versus now that I'm pregnant? So the answer to question one is yes, I do. Anyone from trimester 2 onwards of their pregnancy can come in and see me. In terms of what modifications I make, let's say for example someone is face down, they're getting a back massage. If somebody's coming in to see me but they're pregnant, I would not massage somebody in that way, so they wouldn't be face down. They would be on a seat essentially, and they'd be facing away, but they would be upright seated. So little modifications I make in terms of the position. If it's a leg massage, what I'll do is I'll get the bench all the way up so they'll be upright seated but on the massage bed. But there are modifications I make. There's specific areas that we want to keep tight in terms of lots of hormonal changes. The body's preparing for labour. So essentially some areas that are getting tight, that's because the body is making those necessary hormonal changes. But there's other areas we can certainly release and certainly look to give people more of a pain-free outlook when going through pregnancy. But there is a very strategic and specific process that I would do with someone that's going through pregnancy. One of the more awkwardly asked questions I get, and something really worthwhile to put into this video, is clients asking me, Travis, what happens during a massage in terms of what do I take off? What do I leave on? Do you massage over clothing? Is it under clothing? So let's cover this topic. So let's take somebody coming in for a back massage and a leg massage. Let's take that as the scenario. For a male, there's either two options they've got. Either they can just strip down to boxers, or alternatively, they may prefer to have loose fitting shorts when they come in for that treatment. Either or is fine, and it depends on how comfortable they are. So those are the two options. In terms of females, let's say again, they're getting a back massage and a leg massage. What I would ask is they either come in shorts, or alternatively, if they're happy with just being in underwear, that's fine as well. Whatever makes the client feel most comfortable. Now, in terms of when I treat the back is uncovered. What happens is I let the client know exactly where I want them, how I want them to face. They're covered over with a towel, and then I leave the room, come back in and knock before I do so. So they're completely covered up. I leave the room before they get undressed, and that's how that works. In terms of clothing and why I don't massage over clothing, there's two really important aspects of my job, which is palpation and feel, and also as well the visual impact of what I'm doing. So I'm looking directly at how I'm treating, making sure I'm on the right areas. So if I lose that because I've got a barrier of clothing there, one, I'm going to deliver potentially a substandard service, and two, also, if I think about, let's say, a client with a lump or something like that, if they've got clothing over that, I might miss something that could potentially be really serious and also cause a doctor's referral. So it's, for me, one, unsafe as a therapist, and two, I'm not going to be able to deliver anywhere near the style and type of massage or quality of massage I need to do in order to be able to deliver the client's wants and needs with clothing on. So I don't massage with clothing on. However, I can refer to someone else that maybe would be willing to, but it compromises what I can do as a therapist. The last question I'm going to cover in this video is the minimum age that I treat from. So what is the youngest that I would see someone in clinic? The answer to that question is 8 years old. The difference is if somebody is 8 to 16, they do need a parent in the room with them. This is a really positive thing, however, because it allows me not only to chat to the child, but also the parent about what I'm doing, why I'm doing it, how it's going to be beneficial, and a plan moving forward so they can both absorb what I'm saying at the same time. The child also will generally feel a lot more comfortable having a parent in the room. And there are occasions where I get 16, 17, 18, 19-year-olds come in and they feel more comfortable if their parent comes in, and that is absolutely fine. I'm more than happy to do that if somebody's over 16. That concludes the end of this FAQ video. I think one of the most common things for me is the USP that I give people here is the fact that I am a personal trainer and I have been doing this and sports massage therapy since 2015. So I'm highly experienced. I've seen thousands of clients in a personal training sense and also a sports massage therapy sense. So I can give a unique perspective on both corrective exercise and training as well as manual therapy. I hope this video has been a help to you, and if you have any questions at all, don't hesitate to contact me on my website. I'm more than happy to answer any questions, even if they seem really silly, before you book in for treatment. Thank you very much for watching, and take care.